Healthcare reform. Why are people so worked up? Why are Americans so worked up about healthcare reform? Statements such as "don't touch my Medicare" or "everyone should have access to state-of-the-art healthcare" opinion uninformed, and visceral responses that indicate a poor understanding of our healthcare system's history, its current and future resources, and the funding challenges that America faces going forward. While we all wonder how the healthcare system has reached what some refer to as a crisis stage, let's try to take some of the emotion out of the debate by briefly examining how healthcare in this country emerged and how that has formed our thinking and culture about healthcare. With that as a foundation, let's look at the pros and cons of the Obama administration healthcare reform proposals, and let's look at the concepts put forth by the Republicans. Access to state-of-the-art healthcare services is something we can all agree would be a good thing for this country. Experiencing a serious illness is one of life's major challenges, and to face it without the means to pay for it is positively frightening. But as we shall see, once we know American health care and the steps we can personally take to make things better. A recent history of American health care, what has driven the costs so high? Key elements of the Obama health care plan. The Republican view of health care: free market competition, universal access to state-of-the-art health care, a worthy goal, but not easy to achieve. What can we do? First, let's get a little historical perspective on American healthcare. This is not intended to be an exhaustive look into that history, but it will give us an appreciation of how the healthcare system and our expectations for it developed. What drove costs higher and higher? To begin, let's turn to the American Civil War. In that war, dated tactics and the carnage inflicted by modern weapons of the era combined to cause ghastly results. Not generally known is that most of the deaths on both sides of that war were not the result of actual combat, but to what led to wound care, related surgeries and/or amputations of the affected limbs, and this often resulted in the onset of massive infection. So you might survive a battle wound, only to die at the hands of medical care providers who, although well-intentioned, their interventions were often quite lethal. High death tolls can also be ascribed to everyday sicknesses and diseases in a time when no antibiotics existed. In total, something like 600,000 deaths occurred from all causes, over 2% of the U.S. population at the time. Let's skip to the first half of the 20th century for some additional perspective and to bring us up to more modern times. After the Civil War, there were steady improvements in American medicine in both the understanding and treatment of certain diseases, new surgical techniques, and in physician education and training. But for the most part, the best that doctors could offer their patients was a way not yet available to handle serious illnesses. The majority of deaths remained the result of untreatable conditions such as tuberculosis, pneumonia, scarlet fever, and measles and/or related complications. Doctors were increasingly aware of heart and vascular conditions and cancer. This very basic review of American medical history helps us to understand that until quite recently, around the 1950s, we had virtually no technologies with which to treat serious or even minor ailments. Here is a critical point we need to understand. Nothing to treat you with means that visits to the doctor, if at all, were relegated to emergencies, so in such a scenario costs are curtailed. The simple fact is that there was little for doctors to offer, and therefore virtually nothing to drive healthcare spending. A second factor holding down costs was that medical treatments that were provided were paid for out of pocket, meaning by way of an individual's personal resources. There was no such thing as health insurance, and certainly not health insurance paid by an employer. Except for the very destitute who were lucky to find their way into a charity hospital, healthcare costs were the responsibility of the individual. What care costs has been, and remains to this day, absolutely enormous. When health insurance for individuals and families emerged as a means for corporations to escape wage freezes and to attract and retain employees after World War II, almost overnight a great pool of money became available to pay for healthcare. Money, as a result of the availability of billions of dollars from health insurance pools, encouraged an innovative America to increase medical research efforts. more Americans became insured, not only through private, employer-sponsored health insurance, but through increased government funding that created Medicare and Medicaid, 1965. In addition, funding became available for expanded veterans' healthcare benefits. Finding a cure for almost anything has consequently become very lucrative. This is also the primary reason for the vast array of treatments we have available today. I do not wish to convey been saved, extended, enhanced and made more productive as a result. But with a funding source grown to its current magnitude, hundreds of billions of dollars annually, upward pressure on healthcare costs are inevitable. Doctors offer and most of us demand and get access to the latest available healthcare technology in the form of pharmaceuticals, medical devices, diagnostic tools and surgical procedures. So the result is that there is more healthcare to spend our money on, and until very recently most of us were insured, and the costs were largely covered by a third party, government, employers. At an insatiable and unrealistic public demand for access and treatment, and we have the perfect storm for higher and higher healthcare costs. And by and large the storm is only intensifying. At this point, let's turn to the key questions that will lead us into a review and hopefully a better understanding of the healthcare reform proposals in the new bill. Can America maintain its world competitiveness when 16%, heading for 20% of our gross national product is being spent on healthcare? What are the other industrialized countries spending on healthcare, and is it even close to these numbers? When we add politics and an election year to the debate, information to help us answer these questions become critical. We need to spend some effort in understanding healthcare and sorting out how we think about it. Properly armed, we can more intelligently determine whether certain healthcare proposals might solve or worsen some of these problems. What can be done about the challenges? How can we as individuals contribute to the solutions? The Obama healthcare plan is complex for sure. I have never seen a healthcare plan that isn't. But through a variety of programs, his plan attempts to deal with increasing the number of Americans that are covered by adequate insurance. Our access to healthcare is not adversely affected. Republicans seek to achieve these same basic and broad goals, but their approach is proposed as being more market-driven than government-driven. Let's look at what the Obama plan does to accomplish the two objectives above. Remember, by the way, that his plan was passed by Congress and begins to seriously kick in starting in 2014. So this is the direction we are currently taking through insurance exchanges and an expansion of Medicaid. The Obama plan dramatically expands the number of Americans that will be covered by health insurance. To cover the cost of this expansion, the plan requires everyone to have health insurance with a penalty to be paid if we don't comply. It will purportedly send money to the states to cover those individuals added to state-based Medicaid programs. To cover the added costs, there were a number of new taxes introduced, one being a 2.5% tax on new medical technologies, and another increases taxes on interest and dividend income for wealthier Americans. The Obama plan also uses concepts such as evidence-based medicine, accountable care organizations, comparative effectiveness research and reduced reimbursement to healthcare providers, doctors and hospitals, to control costs. The insurance mandate covered by points 1 and 2 above is a worthy goal, and most industrialized countries outside of the U.S. provide free, paid for by rather high individual and corporate taxes, healthcare to most, if not all of their citizens. It is important to note, however, that there are a number of restrictions for which many Americans would be culturally unprepared. Here is the primary controversial aspect of the Obama plan: the insurance mandate. The U.S. Supreme Court recently decided to hear arguments as to the constitutionality of the health insurance mandate as a result of a petition by 26 states' attorneys general that Congress exceeded its authority under the Commerce Clause of the U.S. Constitution by passing this element of the plan. The problem is that, if the Supreme Court should rule against the mandate, it is generally believed that the Obama plan as we know it is doomed. This is because its major goal of providing health insurance to all would be severely limited, if not terminated altogether by such a decision. As you would guess, the taxes covered by point 3 above are rather unpopular with those entities and individuals that have to pay them. Medical device companies, pharmaceutical companies, hospitals, doctors and insurance companies all had to give up something that would either create new revenue or would reduce costs within their spheres of control. As an example, Stryker Corporation, a large medical device company, recently announced at least a 1,000 employee reduction in part to cover these new fees. This is being experienced by other medical device companies and pharmaceutical companies as well. The reduction in good-paying jobs in these sectors and in the hospital sector may rise as former cost structures will have to be dealt with in order to accommodate the reduced rate of reimbursement to hospitals. Over the next 10 years, some estimates put the cost reductions to hospitals and physicians at $500 billion, and this will flow directly to and affect the companies that supply hospitals and doctors with the latest medical technologies. None of this is to say that efficiencies will not be realized by these changes or that other jobs will in turn be created, but this will represent painful change for a while. It helps us to understand that healthcare reform does have an effect, both positive and negative. Please subscribe, like, comment and share the video.